Is it good? Because I didn't get that warning.
Yeah, it's recording.
Okay. All right. Three, two, one. Good afternoon, everyone. Welcome back to another episode of Mind Split Cafe. My man Matt, we got a special one today. How you doing?
I'm great. I'm great. Just super busy as always. But yeah, I'm excited about this episode. Yeah, I can't wait to talk to Aaron.
Yeah, no, it's going to be a good one. So, Aaron, Dr. Aaron, sorry. We have Dr. Aaron here today with us. You want to give yourself a quick little rundown on your credentials and why you're here today, and then we can get started?
Sure. I'm Aaron Reichlin. I'm a psychiatrist in Chicago, Illinois. I've been practicing for about 18 years, and I am working on developing a new software system for mental health providers that aims to uh, ultimately increase capacity in our strain system for quality psychiatric care and psychiatric level assessment, regardless of who you are in mental health. And so that's what we're really trying to develop. And that obviously at this stage of where we are in the world, we're using new technology and what we call hybrid AI to manage that. So I'm really excited about what we're working on and happy to talk about it with you.
The
Yeah,
fusion
no,
of psychiatry and technology. I mean, that's pretty groundbreaking stuff.
yeah, no
You
kidding.
know, one would think that it would be less groundbreaking considering where we are at in this sort of technology boom. But I think I can say this as a psychiatrist, we're pretty backwards when it comes to technology. We're pretty old fashioned. Some people in my field are just learning how to use voicemail. Um, so it is a good point you bring up.
Yeah. So, I can't wait to talk more about your platform and what you have developed. But let's start with how you got to that point. Like, what made you come up with this? What made you put together a group of people to make this groundbreaking initiative? Let's talk about that part.
Yeah, I like I said, I've been in practice for about 18 years. I trained at Northwestern in Chicago, went straight into private practice, and then was part-time associate residency training director there, and I was the medical director of their outpatient clinic. I got a good feel for caring for people, and in my private practice, which has been a cash practice, I have I have a moderately sized but still relatively small practice. People that I think I've helped tremendously over many years, but I wanted to do more. I wanted to be able to treat more people and sort of bring expertise to more people in need. And
Mm-hmm.
I was struggling with how to do that. And so I realized I was expensive. It took time to do a good job, and I just was at the limit of what I could manage. So I talked to my friend Alexander, who is now the COO of our company. He's a software engineer, and I said, "Hey, I've got an idea." And I've come to him with many ideas over many years, some of which were not very good. Uh, I wanted the mobile haircut studio just on the side. He actually liked the idea, but it just
And
didn't
that
seem like
that
I was.
probably it's timing of it, because had that been presented right at COVID, you would
That
have
was.
had a winner. You know?
I think it would have been a winner at that time.
Yeah.
Unfortunately, I will be honest, it was not. And so we passed on it. But when I told him about this idea, he said, "Look, I'd really love to help. I don't know how you feel about this and working with your best friend." But I said, "Okay, let's go." And we started basically on New Year's Eve or New Year's Day, January 2023, and we haven't really stopped.
That's awesome.
So
That's
Wow.
some major traction in a little
Yeah.
bit over a year. That's phenomenal.
we've been very fortunate. I think one of our best assets is our team, our people. We're very much sticklers for excellence and a culture that, can deliver the product that I'm looking to build, because it's very important for other psychiatrists, psychologists, other therapists, and even primary care doctors, which are sort of the de facto mental health care network, as it is.
It's true.
And so we're very excited about what we're building.
Yeah, no, absolutely. I can see, and I've been seeing it all over LinkedIn, social media. I'm in connection with a couple of your board of directors, people on the board, and they've had nothing but great things to say about it. And that's exactly why I reached out to you. I'm super excited to learn more about this. It's revolutionary, especially for the mental health field, because it's a dying breed.
Well, and I'm really excited that you wanted to talk about this and help us get the word out. Really, we're still at the phase this whole year is about kind of product refinement and testing. We're in the midst of our build now. We're working with a couple of partners besides me, to kind of gather and test different aspects of the inner workings of our software, but we'll be eager to deploy a much prettier version than what I've been using for about 10 months in my own private practice. So yeah, it's remarkable. I mean, this whole journey has been really interesting, really challenging. I've never done something like this before, but I think we have surrounded ourselves with some of the great advisors and board members that you may know as well. And I think we're cooking.
Yeah,
Nice.
absolutely. Sorry, Matt. I thought you were going to say something. You look like
No. I was just agreeing with Aaron. I think that the idea is one, it's well needed. I mean, I believe it's going to be well received, right? Because I believe there is a need. Now, the question I have for you is, from the end user's perspective, right? You're the clinician, you're the one that's behind the curtain, so to speak, putting the app out there, right? From the end users, if I download the app, what can I expect as a new user to this app when it's finally loaded or when it's finally done?
That's a good question. I think first of all, the way we have sort of constructed our go-to-market plan at this point is, we are going to help providers manage their clients, these end users you're talking about, and prospective new clients, more efficiently with higher, faster, high quality assessment and care. So that really hits a number of problem areas in the whole sequence of mental health care, the puzzle that is our current system. But you mentioned a great one, which is really the patient experience and how is this going to help them? Well, what it's done so far, for the people that I've worked with, is it's helped them be understood in a faster amount of time for significantly less cost. My patients that I see in my private practice, might pay me, many hundreds of dollars for an initial evaluation, which I, do in about an hour and 15 minutes. Might be $700 for that. With this software, I'm able to start that evaluation digitally immediately and offer that to them for $99 or $149.
Okay.
That's quite a savings, and it's been able to allow more people to see me that couldn't have before.
Yeah.
So they get to save money, or they get to start immediately and be better understood by the time they meet with the provider, right? So even patients that are using insurance to pay for their visit, that copay starts their assessment immediately and shortens the time overall a little bit, shortens the live meeting, which follows that digital assessment, considerably, but actually increases understanding. It helps the story be conveyed and understood. I hear a lot of times people's experiences with other psychiatrists and providers. Sometimes the visits are so short, so rushed, arbitrary, almost in the way that it kind of proceeds in terms of what to do, kind of medication wise or treatment wise in general. And they walk out feeling confused, less understood, and sort of like disheartened by the entire experience.
Yeah.
Altogether. So this is really designed to help a patient, a client, tell their story and be understood faster. And it's also designed for the users who may be non-psychiatrists to be able to refer those patients immediately for ongoing for psychiatric consultation if needed, which is something that just doesn't happen right now. So the wait lists are so long. Offering that to a client or a patient is just tremendously helpful. And arming that provider with insights about that patient right at the beginning really help patients feel connected and like they're cared for.
Yeah,
now,
absolutely.
Can the experience be completely online? When I say online, like through the app, or is this just like a prerequisite type, kind of get some information and then pull you into to the doctor or to the physician, in person? Or can it be completely online? Can I be connected to a physician that's in Boston, Massachusetts? I guess that's what the question is.
Okay, so there's three questions there, and let me answer all three of those. Number one, whoever the patient or client is seeing, it would depend on where they could be seen based on the licensure of that client, right?
Okay.
So if that client is licensed in the state that that person's residing, then that's where they can be seen. And that varies a little bit in certain states, whether you can see someone across state lines. That's a very complicated legal question. But suffice it to say, I think the second part of your question is this all entirely online, digitally and asynchronous, right? Meaning
Yes.
without a doctor needing to see them. The answer is no, at least not in the initial intake. What this system does is it sort of divides care into two parts: initial screening and intake, like that first appointment, and then ongoing care. And let's talk about each of those separately, and I think it'll make a little more sense. Although a lot of the same technology underpins both, what this system does is it allows patients to be able to kind of narrate and be asked a series of questions, tell their story, such that all of the information, the note that would come to the provider, would be sort of written ahead of time. But that live session is still important, whether that's in person or virtually live.
Yeah.
That live encounter is a needed part of the initial appointment. But the ongoing care, which is really the special part of our platform, is designed to allow patients to be seen exactly when needed. They're triaged by our technology and assessed on a schedule that's determined by the doctor ultimately, in a series of modalities. And those modalities are sort of woven together to create an understanding of that client or of that patient that then can help the doctor know that the patient's either stable and safe and doesn't need to come in for an appointment, or that they need to be seen. And when those visits are needed, they can be extremely brief and focused because a lot of the information is already at hand.
It's already, it's stuck.
So what this is really a speed to quality assessments and speed to quality ongoing care, because my belief is most of the visits in psychiatry, at least on an ongoing infrequent basis, are really not based in any evidence. They're either too frequent or not frequent enough. And both of those are problematic and really creating a lot of waste in mental health care. So I think that by doing things this way, we're going to wind up opening up capacity in a way that has been, significantly needed in psychiatry for a long, long time. And that's just a start.
Yeah, it's just the
That's
beginning of it.
fantastic.
I love the fact that it can be triaged via AI. That's phenomenal. I think that's probably one of the not most time consuming, but that's like the hardest thing to get past is the first part of it, triage, getting that, and then being seen by the doctor. So I love that aspect of it. We talked a lot about how or what the patient gets out of it, and how does what's the patient see, and what's the patient get out of this platform. So what is the doctor going to see on their side?
So the doctor is going to get essentially an intake consultation note that's going to be about as detailed as a psychiatrist who has all the time in the world to write. I almost equate it to what the fourth-year medical student can write with the knowledge of what the 15-year experienced psychiatrist can kind of assess. But what they're going to get is they're going to get a series of in pieces of raw data and compiled data that will look much like a history, with insights and places to kind of consider looking, or ideas about treatment for the doctor to consider. The doctor is always in the loop on every decision, and nothing is decided for the doctor ever in our system. It's really a hybrid partnership between AI and the human being, where the best skills of each, the processing speed and the data and the computational speed of a machine can be partnered with the intuition and empathy of an expert, such that you wind up doling out a much, much smaller, more focused, higher quality experience in those live visits that basically will reduce costs and increase access for everybody. So the doctor gets that and that insight, and then the doctor is also able to see more patients if they wish, or they can wind up just generating more free time for themselves because they are no longer kind of monetized, incentivized in the same way, as it turns out.
So you guys have literally turned a smart doctor into a superhero. You have created them to be smarter because now they have AI behind them on top of what they already know, and it allows them to move through patients more efficiently and more effectively.
Right. I would say that it allows them to be a little bit like a superhero and know exactly where to look and when, and have some insights as to why. But all the decisions and all of the the final doctor insights or provider insights are left to the provider and the doctor. I don't believe that we're even close to the point where machines can make those decisions. But we do think we have safely applied this hybrid technology to kind of allow doctors to move faster and more efficiently, but with greater quality, which again comes down to understanding the patient's story and knowing what to do. And that's really the underpinnings of empathy, which is really what's missing in a system beleaguered by burnout already.
Yeah, absolutely.
I mean, it sounds, it's kind of like, when I'm sure all of us have experienced this, but you have that moment where it's like, why didn't I think of that? Like, it sounds so like, I don't want to say I don't want to make it sound basic, but it sounds so
like we should have thought of this years ago.
We should have thought about this before, right? Like, how come it hasn't been done before? Like, it just, obviously there's a need for it. I'm in awe of it. Like, why hadn't this been done before? Don't get me wrong, I'm super thankful and glad that you thought of it, right? This is your project, but it's why didn't this come around long before? Why wasn't this around a couple years ago?
I can answer that. I've got a theory for you on why that is. Um, the tools that we're using to do this are literally about 7 months old or 8 months old at this point. Um, we've been talking about measurement-based care in mental health for, the better part of, 3 or 4 years. Data analytics and AI are really not brand new, but what is brand new is some of the underpinnings of our current, tech stack allow us to think more about the complexities of measurement-based care. The notion that, which I don't know if you're familiar with what measurement-based care is. It's basically like providing an intervention as a mental health provider and then checking to see how that intervention worked by asking patients or taking certain measurements, right, from patients to demonstrate that it did or didn't work. But the limitations of that construct, and look, my colleagues and friends and other people that have worked really hard to implement solutions around measurement-based care, my hat's off to them. I mean, this is really the stepping stone for a lot of the tools that are coming out now. But I always saw the measurement-based care as having a major flaw, and that is so much of it relied exclusively on patient self-report, which is where we've been in mental health care and psychiatry for the better part of, at least 50 or 60 years.
Yeah,
anyway.
Its existence, pretty much. Yeah.
For me and the people on our team that think alike, the challenge with measurement-based care is being reliant on self-report alone is a challenge. That wasn't enough for me in knowing, saying, okay, I want to care for more people. Well, I got to do it the way that I do it in my session. I think about their overall story. I listen to them. I listen to how they talk to me. I ask other questions that sort of give me insights into what they really need. And so what we've done is we've adapted pieces of all of those elements of what an expert does, and we've mixed it in to these self-reporting methodologies to create a much richer composite picture. So we call it care-based measurement. We're really thinking about the story and the entirety of that patient story to understand how people are really doing, which allows me to, see more people at a higher volume at a lower cost, because I can trust this hybrid partner of mine, the computer. So that's why it hasn't been thought of before, in my estimation. I don't think the tools were there at that time, which is sort of interesting, because I think it means we're going to be entering a whole nother phase of this AI boom, really.
Absolutely.
And we hope to be there and try to help as many people as we can.
So I got $1 million question for you, and it may be proprietary information, maybe, but in your clinic, how has it done? How has it performed? If you're able to share that, I mean, has it increased your ability to see patients by 10%, 20%? What does it looking like in your clinic specifically?
So we're still moving slowly on increasing the numbers. I have, and the reason why is because I want to make sure it's safe. So I'm still managing. I'm managing about 70 patients on this protocol at this time, and still overseeing things pretty closely. But what we're seeing is already pretty incredible. I mean, in terms of freeing my time, it has definitely done that. It has helped me with my revenue. It has lowered the costs for patients who now have access to me exactly when they need to, and not inefficiently when they don't. we're seeing early signs of some signal on how some of the results are excitedly pointing towards the new utility and being able to identify things that I couldn't have seen even prior. But we're still very early in collecting that data. That data set is still very small, and so I'm not really prepared to make any claims on the data. But it's exciting. I can tell you qualitatively, a lot of patients are extremely excited about this because they have sort of the best of all worlds. They have me when they need to. They're happy to sort of digitally check in, and they appreciate the savings for the care that they get when they need it.
You know, the ability for a patient to not have to wait and to be able to access you when needed is huge, especially in the mental health care. Because when I've been in the past, when I've tried to do mental health care visits with a counselor or whatever the case is, there is literally a week wait at the very minimum. Like I am waiting a week to get an appointment. So that's game changing for you to be able to do that.
Well, that's sort of one of the problems, of course, in the system is this: the demand outstrips the supply significantly. And so there have been various ways to attack that problem. I think a lot of companies have taken a variety of different approaches to accomplish that. And all of them are really, I think there's room for everyone to kind of take elements of all of those strategies to market and really help a lot of people. I really think that what we have works together very well with a lot of the other options, and really refines that patient experience, the story that they get to sort of share, the connectivity in a way that I don't think we have yet found in the marketplace. So, I think we all have to work together to solve these problems. These are big problems. And we're going to need all of these strategies together in many instances to kind of really affect great change.
Yeah, I couldn't agree more.
I think you're onto something. I'm excited to see it really, really, roll out. And speaking of rolling out, is there an estimated time? I don't want to put a hard date on when it launches, but what are we kind of looking at as far as time frame right now, estimated, where it is in the public's hands?
Well, we're in our build phase. I think we're always going to be in our build phase, but we're going to have our product kind of hopefully ready for use for the select individuals and companies that are going to be sort of piloting it with us. Probably sometime by the late summer, early fall. We'll gather that information probably through the end of the year. And the hope is starting early in 2025, we'll be able to roll this out to certain segments of the market, to start using the features that we've been building. So my hope is that, early next year, hopefully, we'll be able to start getting this into more people's hands.
That's exciting stuff.
So it's very exciting for us. This is a really great, very exciting, very exhausting time for all of us.
Well, we'll definitely have to have you back when it launches. So, that way we can do the proper rollout. It'd be awesome.
I'd be very delighted to do that. It's, it'd be my pleasure.
Now, is there any information as far as like website, social media that you can plug in so our listeners can keep in touch or up to date with the rollout?
Yeah, well, we just talked to doctors at the APA really for the first time early this month. We have a website that is recently up. That's at psychnow.com. We just started a LinkedIn presence, a LinkedIn channel for Psych Now. Still very much in its infancy. I think our first post was a picture of us at the conference a couple weeks ago. But we'll probably put other announcements up there.
Right.
So feel free to, follow along with us if you can, and reach out. I'm happy to talk to anybody. I mean, we do have on the website you can reach out to us, and we will contact you if you have other questions or other interest.
Yeah,
That's
absolutely.
awesome.
We'll make sure to plug that information in as well, so they can come back to the episode or to our resource page and be able to get your contact information and reach out.
Yeah.
Sounds great.
Yeah. Well,
And
Dr. Aaron, thank you so much for joining the show, and we really, really appreciate it. And we're really, really excited about Psych Now and what is, what's the promising future starting in Q1 of 2025 when you roll this thing out, and how many people you guys can help, whether it be an economic situation or just a time situation, lack of time, whatever. I'm really excited to see how many people you can effectively help.
That's all we want to do is bring quality expert care to more people, regardless of who you're seeing
Yep.
in the mental health care system,
Yep.
as soon as possible. But we're as excited as you are. So I mean,
Yeah.
thanks so much for having me, and I look forward to keeping you guys updated.
Oh,
Yeah,
we look forward
absolutely.
to it too. And you're welcome back anytime. Till next week, guys.
Thanks a lot.
Mind Splitters. We'll see you next Friday.
Thank
Take
you,
care.
everyone.